Hi, thanks for clicking the link to the video for the conditions alleviated or treated by NCR. I'm Ian Headley. I'm the UK's first fully certified NCR therapist, having been trained by the developer, Dr. Dean Howell, at the NCR Research Institute in San Diego, California. Now, NCR is a physical medicine technique, but it is also described as a naturopathic medicine technique. Now, what I mean by that is that we don't directly treat or cure any conditions through NCR, rather we move the body into a more optimum functional position in terms of its musculoskeletal system and nervous system, and we remove the stressors in a patient's body, allowing the patient's own innate healing capacity to kick in and then to heal themselves of whatever ailments or conditions they are suffering from. Now, NCR is routinely successful at treating any conditions that stem from a mechanical structural origin. So we routinely and successfully treat patients with headaches, migraines, head pressure, if they all stem from a mechanical injury or trauma. So if a person's had a blow to the side of the head and the cranial bones have been moved into an asymmetrical alignment pattern, no amount of pills or medicines is going to be able to move those cranial bones back unless you have an NCR treatment series or several NCR treatment series, which will aim to restore the cranial bones to their symmetrical alignment pattern. NCR is also extremely successful for treating chronic sinusitis and stuffiness and pressure in the sinuses. Now, the sinuses are essentially caves within the facial bones, and they all drain at one end. So if you imagine like a bathtub that's got a plug at one end, that's kind of like the sinuses. Now, if the sinuses are aligned the way they're supposed to be, then all the mucus and nasties that are in the sinuses then drain out, and the patient doesn't have any pain or stuffiness. But if the facial bones are misaligned and then the drain is at the wrong end, then you get like a pooling of the mucus and the bacteria and the nasties in the sinuses, and the patient gets pain and stuffiness, and then routinely has to have antibiotics to keep bacterial infections at bay. But with NCR, we can move the facial bones into a more symmetrical position and position the sinuses so that they drain correctly, and then the patient is relieved from some of the stuffiness and unpleasant symptoms that they were suffering from. NCR is also extremely successful at treating TMJ joint dysfunction. So where the lower jaw, the mandible joins or articulates with the skull is at the temporal bone. Now, the temporal bones, if they're not aligned symmetrically, then the jaw joint is not going to function properly, and you get clickiness and popping and discomfort in that joint. Now, dentists routinely try and treat this with splints and orthotics to try and position the lower jaw into a better place. But if the cranial bones are misaligned, that approach is always going to be slightly limited. So what NCR can do is routinely move the cranial bones and the temporal bones into a more symmetrical pattern and allow the jaw joint to function and open and close without any pain or dysfunction, and much smoother. We often have great success with patients with neck pain, back pain, and abnormal curves in the spine. So scoliosis, kyphosis, lordosis, all these abnormal spinal curvatures are all patterns that the postural patterns that the body takes on in order to maintain stability, because unfortunately the body prefers to be stable and you to be in pain and you to be out of pain and unstable. So the way that the cranial bones line up determines the way that the spine functions and the posture that the spine takes on. So if the cranial bones are misaligned, then the spine has to take on abnormal spinal curvature in order to keep your head upright and your eyes level with the horizon. So NCR, again, is routinely successful at treating chronic neck, shoulder, low back pain that hasn't been routinely treated with other physical medicine techniques. Now, when we start to improve the musculoskeletal system of the patient's nervous system, which includes the brain, then starts to improve. So patients that have like emotional problems and anxieties and phobias and depression, they routinely, over time, it's not a quick one treatment cure, it's a slow, cumulative, incremental treatment. Patients then start to be less bothered by some of their neurological problems. NCR has been successful in treating dystonia patients, again because it's a mechanical cause fundamentally, that the back of the brain stem is being pinched by a misaligned cranial bone. So if you start to take the pressure off that part of the brain, then the symptoms of the dystonia slowly start to subside and the patient improves. So as you can see, there are a number of treatments and there are a number of conditions that are routinely treated using NCR. If you'd like to learn a little bit more about any of these conditions, you can view the Conditions Alleviated tab on this website, or you can visit Dr. Howell's website, which is www.ncrdoctors.com, and you can read more about the conditions that have been successfully treated over many, many years using the NCR technique. Thanks for watching.